The world needs hope at the moment. We need to give people with cancer hope that things are possible. My name's Dan Thomas. I'm the director of the blood cancer program at SAHMRI and lead the Myeloid Metabolism Lab. And I'm a clinical haematologist at the Royal Adelaide Hospital. Cancers are generally driven by somatic mutations. There's over 22 that we commonly see in the hospital, but we really only have targeted therapies for 2 of them. My goal is to find as many new targeted therapies and hidden vulnerabilities for these other mutations as quick as we possibly can. When you or your family member is diagnosed with cancer, there's a terrible sense of doom, of hopelessness, and historically that was so. But we are beginning to see a number of ways we can tackle the key driver mutations that give rise to cancer. And certainly what we are realizing, and there's a lot more hidden vulnerabilities for many of these mutations than we previously were aware of. By launching themselves in one direction, they actually have lost the ability to do many other normal things a cell can do, and we can use that for an advantage. We were very surprised to see these cancers are actually building their own loop, if you like, of hormones. So they're making a pro-inflammatory hormone that they're then feeding off to grow. And if you block that with an antibody that has absolutely no side effects, then you can stop it growing. We're getting a 75 to 80% complete remission rate now in the clinical trial I'm running based on our lab research for a disease called CMML, chronic myeloid monocytic leukemia, that has no known effective treatment. And we think it's probably a principle across many other cancers that they are secretly making their own hormones, and if we can work out the non-redundant ones and block it, then you can really stop it in its tracks without having to use chemotherapy or radiotherapy. Our goal in the next 10 years is to have at least 8 new therapeutics or diets available to the public, especially for the really tough mutations. I derive a lot of satisfaction from the human-human interaction with my patients, and seeing them respond to things that you have developed in your own lab is terribly exciting. I had a recent example of a GP, retired GP, a wonderful chap, and he was diagnosed with a blood cancer. He was told there's nothing you can do, needs to prepare his will. We got him on the clinical trial. He's now twice the expected survivor for that disease. So he's now not only feeling better, he's advocating for excellence in research across all of the GPs in South Australia. We've re-inspired him to live and to give back to the community. I also really enjoy interacting with the other scientists in my group. We're continually surprised by the biggest discovery will come from things we didn't actually were thinking about. We happened to notice when we were doing another experiment. Discovery is like a gift that's bestowed upon you. It doesn't really come from you, and that's a really special feeling. But it's not about us. It's about serving the common good.